to enroll for health care next year, and hopefully Texas will be doing better than this. In the last census, more than 17% of Texans said they went without health insurance. That is the highest rate in the nation. Bradley Blackburn shows us what that need really looks like.
There may be no better picture of the problem with healthcare in America than right here, this moment in Fort Worth. Outside the Will Rogers Memorial Center, the lines wrapped around the building. Thousands of people waiting not for a concert or the rodeo, but for free healthcare.
I didn't realize there'd be so many people.
In September, we reported on it as it happened, but what happened at this clinic is worth a closer look.
My doctor wanted me to get x-rays. I can't afford to pay for the x-rays.
Dr. Lila Lewis founded the organization Your Pathway to Health.
I was actually dumbfounded by the numbers of people that were outside this morning.
We've hosted these free clinics in big cities, a pop-up hospital staffed entirely by volunteers. With dental care, eye care, radiology.
How long has he had this pain on the left?
Even an on-site operating room. And if you assume it's only for those in poverty, listen to this.
The majority of the patients are actually working class people. They actually have health insurance.
We know healthcare costs have soared, but no economic group has been harder hit than the middle class. In the last 30 years, health expenditures have risen 60% for middle-income households. And as politicians have tried to tackle the problem, insurance premiums in Texas for a family of 4 can easily top $1,000 a month, with a deductible of $10,000 or more.
So it really comes down to a question of, do I pay the copay and the deductible, or instead, do I put food on the table for my family?
It's not affordable. It's more expensive than it ever has been.
Every person here has a story. Richard Toney came from Arlington. He's been living with an eye problem for 4 years.
I've tried everything.
He has a job with insurance, but his high deductible keeps him from spending the money to have the growth removed. Money he spends instead taking care of his teenage son.
It's my oldest son. Into the emergency room at one point in time, and they referred me to a doctor. Couldn't really afford and all that.
Thank you.
And Patricia Hernandez drove 250 miles to be here, all the way from northern Oklahoma.
When you're middle class, you still have your obligations. You still have the insurance. You still have to keep mortgage, taxes.
She is a small business owner, but she has sacrificed her health.
Will be my son, and
Knee problems, severe dental issues, but she has simply not had the money.
no health insurance. I raised 3 children after my husband passed away, and took care of my mother the last 15 years of her life. After 27 years, I'm here today, and they are literally putting me back together.
For Patricia, one day was not enough. So it's why we found her again in the middle of the night, waiting outside.
There's going to be 0 sleep, and we're going to sit on the uncomfortable sidewalk.
She's never slept outdoors like this, one of hundreds waiting for dental work. The next morning, she got in. First an exam,
She has 10 teeth that need to be removed. So I'll be able to get dentures or implants.
then in the chair,
Totally exciting.
where they did those 10 extractions.
We want to make sure she's in perfect health.
This time, finding answers and hope at a clinic.
I got my life back. Absolutely got my life back. Yeah.
For those stuck in the middle, the cost of healthcare is more than money.
Heart testing.
It is pride.
I get to be healthy. Yeah.
In Fort Worth, Bradley Blackburn, Channel 8 News.
If you or someone you know needs health coverage through the Affordable Care Act, open enrollment runs through December 15th.